So I want to point out that Kate is having tremendous success with this ketogenic diet program. And the funding came from the Care and Cure. And Jessica Lowe, the dietitian, was just started. So this is your money at work instantly. I understand from Nate and talking to Kate backstage that she is down to 1 seizure a week. So imagine the difference that makes in her life. And that's because of tonight, and that is because of you. There's a strength in this room, and I look out and I see friends. I see Andrew and Nicole, and I think of Chloe. I see Chrissy and Henry, and I think of Ben, who has tuberous sclerosis, but even after 3 brain surgeries, his seizures are his biggest challenge. Colin reminds me of his son James and how determined he was to learn how to walk in Marcy's class. The Baums and their son Sebastian, the Desjardins and their unwavering dedication to their daughter Camille. These parents will tell you, as can I, that seizures can be relentless. They take their toll. They're disruptive to the human psyche, the family unit, your spirit, your soul. You're constantly on guard. You cancel vacations, any plans that you have, and the sheer exhaustion of trying to keep on a brave face and keeping it together, it's absolutely grueling. So knowing what we know, we being Andrew and I, we can't thank you enough for coming out each year. Without your attendance, there would be no Dr. Partikian, a paradigm shifter the first day that he started for an entire demographic of underserved families. Your attendance has transformed Los Angeles County, USC, from a medical bedrock into a dynamic and thriving, innovative pediatric neurology and epilepsy center. It demonstrates both the quality and equality of care and not just the equity of care. From day one, the mission of this dinner has always been to help provide access of the highest caliber to children, regardless of their socio-geographic or economic boundaries. By funding more doctors to enter the field of epilepsy through our partnerships with USC, CHLA, and UCLA, we have been able to do that. Now, funding these fellowships was done out of necessity to address a national and a local critical shortage of doctors entering the field of epilepsy. Now in Los Angeles, largely thanks to you, we have one of the higher concentrations of doctors who specializes in seizures and epilepsy in the country. As Andrew had said earlier, there is a mystery surrounding epilepsy. It's been known for thousands of years, and it's been thought to be spiritually driven or a demonic possession, and that's gone on for a long time. But the mystery of epilepsy, we have our foot firmly planted in the golden age of epilepsy right now. I'm going to tell you some interesting facts so you understand the trajectory and how fast that we're moving. Since Chloe's birth, and Chloe's a little bit older than Ari, in 2000, there have been 17 medications approved and another 18 medications currently being researched and or are undergoing an FDA review process right now. That's roughly triple the amount of medications that were available to doctors in the previous 100 years. It's not us, it's the global thing. Prior to Chloe's birth, there were 25 genes known to cause epilepsy or diseases that included epilepsy. Since then, in the last 13 and a half years, nearly 70 new genes have been discovered that relate to epilepsy. And finally, since 2000, 8 new neuromodulation devices, such as stimulators and implants, have been approved for treatment in epilepsy without any prior. The continued trajectory of new medicine and therapies brings promise and hope. It gives doctors the ability to provide more effective care earlier before seizures do their damage. Now, what this tells me is that if you're not active, you're archaic. And by active, I mean if you are not practicing medicine in a higher volume, dynamic centers like UCLA, Children's Hospital Los Angeles, or USC, you are not seeing the breadth or the nuance of the disease. If you're not current on the quickly expanding medical landscape, you are missing the opportunity to collaborate with colleagues, share in patient management, tinker in the lab, and create breakthroughs. Epilepsy will be cured by those who are actively engaged in a dynamic center for excellence and in a city of excellence. If this is your first time here, you may be confused why I'm standing here. Because on the surface, we have plenty of doctors, as you saw stand up, and the field of medicine and epilepsy seems to be pointing in the right direction. And I would absolutely agree with you. But I would also say that we're at a checkpoint. How we got here and where we go next is totally dependent on nights like tonight. Generally speaking, the system is broken. Highly specialized, intensive, clinically based pediatric care doesn't rank among the bottom of research and educational dollars. It is the bottom. And the same holds true for physician pay. I say this not as an excuse, as unfortunately, there's a shortage of funding that's systemic to the field. I bring this up to demonstrate the proactive measures that we're taking here in Los Angeles. We have been and will continue to be the solution until we have a cure. Our commitment is to let every doctor in medical school today who is thinking about a career in epileptology, who is inspired and driven to a greater sense of purpose, determined to make a positive change, to strive for a cure, that we want them on our team. We need to show them that epilepsy matters by having the necessary funds available for their trainings. Talk to any of these doctors here tonight, and they feel a deep sense of pride by the career choice that they've made. And what we do here tonight is we let them know that while they are the ones in the trenches, that we are their partners, and we care too. Together, collectively, we are the seeds of change. And through them that we have the opportunity to change lives and children who are otherwise sidelined by seizures. And I say that as I have a son who's absolutely sidelined by his seizures. And with opportunity, I think comes responsibility. And as part of the Care and Cure family, it is our responsibility to support those who are inspired and to be inspired by those who we support, our doctors. We hit a checkpoint in 2014. We are faced with a choice. Our fork in the road, red pill, blue pill. Do we keep the status quo, where epilepsy retains its place in history as an underfunded quandary, or do we participate in a cure? Now, I know I ask a lot, and you're here and you've given a lot. But I also know that this is working. Through the years, we have a well-established proof of concept that we cannot let squander. We cannot let cures slip through our hands simply because of money. Money cannot be the excuse between a child who is able to walk through a park, have a nice conversation with his parents, eat ice cream, and tell them that they love him, versus a kid who's not able to walk or talk or simply eat. The lack of doctors cannot be the difference between graduating, getting married, becoming a contributing member of society, versus what people otherwise see as a burden. We're getting closer. I know that we are. And on behalf of Ari and Chloe and Sebastian and James and Camille, it is my responsibility to be here and to ask for more. I encourage everyone in this room to dig deeper, to be inspired, to join the epilepsy revolution, and to give. Now, in front of you, there are no cards and pens. Now, I want to point something out. These are not just pens. They're also mini flashlights. On one hand, stylus on the other for you people that use iPads, and there are also pens. And they are yours to keep. But what I need everyone in this room to do is to participate in helping us cure epilepsy. It is our responsibility. I would like you to consider pledging the suggested donation of $5 a day. And what is $5 a day? It's a cup of coffee or it's an hour of parking in downtown Los Angeles. And if that's too much, $1 a day, 50 cents a day. It's not, and if that's not enough, the sky is truly the limit. But the point is, we want everyone to give. We want everyone to take ownership in all of the doctors that you've seen and all of the wonderful cures that they're able to do that you don't see. I promise this is only money. It grows on trees if you didn't know, and it grows back. Thank you very much for always being here. Thank you much for your attendance, and enjoy your dinner.